Boston Healthcare for the Homeless program has a very simple but a very compelling mission, and that is basically that we provide health care to homeless men, women, and children throughout the greater Boston area. We have 3 hospital-based clinics, one at Boston Medical Center, one at Mass General, and one at Lemuel Shattuck.
Boston Healthcare for the Homeless seeks to bridge the gap, the schism that lies between those who have and those who have not. In this case, those who have health care, those who have financial resources, those who have family and support system, and those who don't have it.
When I first started doing this, I got actually transfixed by the complexity of the medicine. People were really sick. Since I had trained in medicine, that's what I loved to do. And it had nothing to do about the doing good or doing better.
I used to shake the people from Boston Healthcare for the Homeless, and I used to say, what are you doing to get them better? And what are you doing to get them out of homelessness? And they had to educate me about that what we're about is healing and compassion and fixing them up. And that's the first step to getting them out of homelessness, and some of our people will never not be homeless.
Just from my own experience, had it not been for people who were willing to take a chance on me, had it not been for medical, mental health services, whatever I needed at no charge, I wouldn't be here. I wouldn't even be alive.
Everybody has a story. Everybody is somebody's daughter, mother, brother, sister, aunt, uncle.
People talk about homelessness, but it's hopeless. It's not. It's not. They may be homeless, but they're not hopeless. That's what it's about. Some people are functioning alcoholics, others are not. You know, and my brother was the one that wasn't. That led right to the street and was in homeless shelters for a good part of many, many years. It was frightening to think somebody that you love, that came in your family, could turn into a street person. You got to be kidding me.
The nurses describe our patients, when we take care of them here at McGinnis House, as you kind of feel like you're taking care of patients in a war situation, where you patch them up, you get them all under good medical control, you send them out, it's a revolving door, they come back. And the people who do well here, staff-wise, and who thrive here, are those of us who say, you know what, for the few days that they were with us, they were in good health.
While we operate out of 70 sites, 70-plus sites, we have this one very rooted building where we have 90 patients who are being cared for at any given time. And they are patients who are too sick to be in a shelter, but they're not quite sick enough to be in a hospital setting.
Thank God that we still have Barbara McGinnis, because if we didn't, there'd be nowhere to go. Like one time I broke my leg. I broke my ankle, and the doctor at the hospital said, well, go home. At this time, I've been homeless, I've been drinking, so I couldn't go to any of my family while I'm drinking. They don't want me there, and I don't blame them. I wouldn't want me there. But the doctor said, go home and put your leg up. So I'm like, okay, well, what am I going to do? Go, on the bench and put my leg up? No, you don't. You come here, and they allow you to rest, and you put your leg up here.
Every homeless person that comes here has one thing to gain from me. They have to gain the fact that I will empower you. I will take care of you. But by the time I end caring for you for a week, you are going to be savvy caring for yourself.
Donors are making an investment in people who were like me, broken, who were throwaways otherwise. Had I stayed broken, I certainly would not be a productive consumer. And I certainly wouldn't be doing the work that I do now.
So if you're looking at it from a business point of view, this is an excellent place to contribute to, because you can feel very confident that your donation is being handled exactly as you would hope that it would be. And you can't say that about a lot of organizations. It has very low overhead, it's highly productive. But, business people, which I would count my husband and I both business people, we didn't necessarily come to it through those eyes. We came to it through our hearts, and what it does for the community, and what it does for, just to get very sort of lofty, what it does for humanity. And it met our needs of our heart as well as our, brains.
If we weren't solvent and it didn't exist in the way that we exist, there would be no alternative for people but to spend their time in emergency rooms. If we weren't solvent and we weren't able to do what we do, there would be people who never get engaged in health care. And there would be those people who are chronically ill and who live and die without care and alone.
If you're helping me, then you're helping my son, my daughter, my 4 grandchildren, because they all want me back in life. They don't want me sick and in hospitals and out there on the street. So you're not just helping me, you're helping my whole family.
So I think it's critically important for us to figure out ways that we can embrace the care of this population who are really suffering and bring them into the mainstream so that we can really take care of them. I think it speaks legions about our society, about how we treat these folks. And as we all know, if you get engaged in their care, you become unbelievably transfixed by how tough their struggle is and how courageous the battle is that they fight. So I think it's just one of the most important things we can do as doctors and healthcare professionals is to get ourselves fully engaged in how to solve this problem.
And we don't give up on everybody, because you never know when it is going to be the time that somebody gets the inner strength to make new choices for their life.
And when you fail, I am ready to pick you up again and keep going. I will never lose sight. I will never give up on you. Never.